All right, so let's get into this discussion. So there are growing concerns about what a permanent HIV/AIDS funding cut by the U.S. could mean for Africa. Organizations such as Doctors Without Borders are pleading with U.S. President Donald Trump's administration to rethink the matter. Well, let's take the discussion further. We are joined by UNAIDS Eastern and Southern Africa Director, Ms. Githuku-Shongwe, who joins us this evening for more. Anna, good evening to you. Thank you so much for joining us. You know, I think that this is an important discussion because it certainly will give us some clarity as to, you know, an organization like UN, particularly UNAIDS, the steps that can be taken by the body. But let's start here. You've got the Deputy Executive Director of UNAIDS, who was speaking recently in Geneva, painting such a bleak picture, saying that more than 6 million people could die from HIV/AIDS in the next 4 years if that funding is not in place. I mean, what you make of those numbers, and then, of course, if we start to look at what that funding actually does to save lives in Eastern and Southern Africa.
Thank you so much, Naledi, and good evening to the listeners. You know, Naledi, since 2003, we have had such a huge amount of support and global solidarity to end AIDS. You recall, if you were young enough, at the time, we were seeing AIDS deaths at really huge proportions that caused this real huge response that the US government then formed the presidential program to respond to HIV/AIDS, what's called PEPFAR. And the US government started to invest huge amounts of money. In the end, 73% of the AIDS response across Africa across the world really has come from the US government. Our region, East and Southern Africa, has the largest number of people living with HIV across the world in any single region. And so for us, this is very important. We have countries like Tanzania where 90% of the investment in the response, particularly AIDS drugs, being able to ensure prevention, has come from the US government's investment. Zambia, 80%, Kenya, over 30%. So many of our countries have been really hugely dependent on the US government, and the US government and other international partners, the global solidarity, along with our own governments, have been at the forefront of ensuring the progress that we see today. So we've seen huge progress in our region. So we are the highest, but we've also made the most progress in reducing HIV infections, in getting people on treatment, the 95-95 targets for treatment and testing. We've done exceptionally well, but this is turning the tide on that progress.
I mean, it's an interesting and almost frightening sort of revelation when we talk about lives that have been saved and certainly can be lost without that all-important funding. I'm keen to hear your thoughts on whether or not countries in Eastern and Southern Africa are taking the right sort of position and also pleading for the continuation of funding these projects in the two regions, right? And how, if at all, that can be amplified as well.
So I think the first thing that has happened is that many of our governments immediately took a position to say, we will find a way to ensure that everybody who needs the AIDS drugs gets the AIDS drugs. And so that's really been a strong and powerful message from African governments. But of course, this sudden stop means that they haven't had the time to restructure their budgets to be able to take this on long term. So from a sustainability perspective, governments have been preparing that over time, over the next 5, 6 to 10 years, they would be taking over the full responsibility. But this just came on very suddenly. And so they've said, okay, for the immediate, we will do our best to take care. And of course, have been appealing to the US government to reconsider the position. And, slowly the exemptions that have come in have enabled clinics that had already closed down from the initial stop work order have been able to slowly start reopening, at least for the provision of treatment and drugs that are required for those who are needing of these drugs. So that at least has been a bit of a recovery, even though it's been slow and many of the clinics are not yet started. Many, health workers had already gone home. And so they're having to restart that again. So at least there's been some reprieve from a lot of the advocacy that has happened both abroad and from our own African governments. But in the meantime, we're already seeing the impact. So, drop-in centers, clinics that are providing services, especially to those most vulnerable, those for whom girls and young women in our region, 3,000 getting infected every single week. So the prevention tools are not part of the exemption. And so this has been of real concern that we could see a huge spike amongst this population who have done so much better with strong prevention tools. So in general, country by country, in Ethiopia, we've seen drop-in centers, serving women and girls in key populations going down. In Mozambique, we've seen over 1,000 doctors who are out of work for a period, 20,000 community health workers who are dropped because of this funding, 22 centers in Botswana that have been closed. So the ripple effect is massive, and it impacts directly on people and doesn't give the countries time to reorganize themselves.
Yeah.
But it is a big wake-up call.
When you talk about how the U.S., accounting for really the most of the funding for those programs in the countries across the globe, I immediately think about the opportunities that are there for the international community to step in and plug that gap within UNAIDS. I mean, that's and certainly around that funding. I mean, is that a possibility, or am I being a little utopian there?
I mean, we're hopeful. We are hopeful. Of course, it's a huge amount because, as I said, it was 73% of the overall AIDS response. So it's a really, really large number. But of course, we are in discussions ourselves as UNAIDS. 60% of our own funding comes from the US government. And so we are obviously in conversation, not just with the US government, but with other governments to see whether they can, in fact, help us to fill that gap. But this is the same country by country that countries are appealing to other governments, are appealing to foundations, to the private sector. If you recall, there used to be huge business coalitions against AIDS in the early days. And I think there is an opportunity now for us to revisit this and see how we can start remobilizing different partners for whom this remains important for their workforce. And so these are strategies that we're putting together, but ultimately it has to be our own governments who look at what they need to do in the long term. So in the short term, yes, we hope we can get other donors, other partners to come on board. But long term, our own governments are going to have to keep working and seeing how they can continue to increase their own domestic resources, because this is what will sustain the response to AIDS.
Yeah, that's an interesting one, because then we can look at the countries that perhaps in the regions that you cover, Eastern and Southern Africa, that you feel are most vulnerable. I mean, in the past few weeks here in South Africa, there certainly has been the debate around, that funding that South Africa receives only makes up about 17% of what is spent on HIV/AIDS, interventions. But for other countries, that may not necessarily be the case. And so those that you think in the region are particularly vulnerable and may not actually be able to bounce or self-sustain in the near future. Yeah.
So Tanzania, as I said, is 90% dependent on the US government. So that's a difficult one to replace overnight. Zambia is about 80%. So that's another one that's in a difficult position. But Malawi, Kenya, Uganda, all of these are countries for whom it was over 50% funded by the US government. And so we need to, those countries, the shift is so sudden that there's no time to really prepare to be able to take over immediately. And so those that are most vulnerable are the ones that we have already been working with. We started this work before in anticipation that we will see a gradual decline in external funding. But the sudden stop because of this stop work order was completely unexpected. And so those countries most vulnerable. Mozambique is a country that has the largest after South Africa. South Africa is about almost 8 million people. Mozambique is about 2.4 million people who are living with HIV, and a country that has such high vulnerability because of a humanitarian crisis and other issues all along. So these are countries, Malawi has had cholera outbreaks, has had floods, so these are, in addition to having AIDS, countries that are vulnerable in general. And so to suddenly cut their investment makes it very, very difficult to recover. And so we are really keeping an eye on those countries in particular, and to see where resources can be reprioritized to be able to support that response. And I think the other big area that's important, in addition to this particular countries, is the issues. So the waiver that has been given, the initial waiver, an exemption, has been in particular for treatment, but for prevention, for the girls and young women, for key populations, it includes sex workers, gay men and men having sex with men, transgender women. Many of them are really very, very vulnerable, injecting drug users, all of whom are in the spectrum of high vulnerability to HIV. These have not been included in the exemption. And a lot of their services don't come from government. A lot of the services come from external partners. And so how to ensure that these continue is a big concern to us. And we are focusing our attention. Community organizations are coming forward, CSOs, saying we really need support. We need to see how to ensure that we continue. So organizations like TAC, and we can go around the region talking about those organizations that are really, really hit. They're at the brunt of this.
But I think before I let you go, I think the final question for me would be, just for the benefit of our viewers, allow us, the opportunity to be a fly on the wall if we are to see interaction between UNAIDS representatives in the room with the Trump administration. What does that conversation sound like? What does the plea by UNAIDS sound like?
I think the first and most important thing is that the US government has been a significant contributor to a really successful program. This has been for a long time, and the US government has held hands with African governments in real partnership. And we would like to appeal to the US government, the current administration, that the story will be told in the future of how important and significant the US partnership against AIDS has really shaped the future, kept the world safe, kept the US safe, kept other African countries thriving because of this contribution. And it would really be hugely disappointing if indeed after the 90 days, we are not able to continue with this program and with this investment. And so really, it's just a big appeal to say, let's continue. We're almost there, and we're preparing ourselves to take over. African governments are getting themselves ready. We just need to do it in a gentle, planned, transitional way, in ways in which governments can take over incrementally.
And so that's interesting, because what I want to squeeze one last one in, because you talk about governments being able to take over. The interaction that UNAIDS is having with the countries, particularly in Eastern and Southern Africa, around the need to really start developing that self-sustainability. Are those conversations already taking place?
They are. In fact, just last year, we were already initiating discussions on what we call sustainability plans, and governments have done exceptionally well, already preparing themselves with these plans. But as I said, the expectation was that there would be a tapering down of, say, US government and other funding over the next 5 to 10 years. And so governments would look at, incrementally, how much do I increase? 10%, 5% each year, 20%, depending on what the fiscus allows them to do. And so, the plans are already underway. Our executive director, Winnie Biendima, has just come from the AU summit and was appealing to African leaders there to focus on really addressing this funding gap and ensuring long-term sustainability. So we have been working with governments already, but we need to now really scale that up rapidly, because this has been a shock to the system and has left countries really naked and not prepared for this very sudden change. But if it's incremental, governments will be ready, and our working with governments will work because they are preparing themselves already.
Yeah. Yeah, certainly the need to see speed there. And it's been an absolute pleasure chatting to you. Thank you so much for your time. And Githuku-Shongwe there, who is the director for UNAIDS in Eastern and Southern Africa.